everybody. My name is Dr. Evan Darning. I'm an owner and chiropractor at Peak Health and Performance. We're an injury and sports rehab clinic in South Central Calgary, Alberta.
I'm Curtis Lochran. I'm with Crossfit Above All. Crossfit Above All is located in South Central Calgary. What we're talking about today is our third video in our 4-part squat series. We're going to be discussing posture and proper chest push through to create proper lower back alignment and avoid some common injuries that are associated with that. What typically happens, or what we want to see happening with the squat, we've discussed proper hip hinging, getting your bum to press back, and we've got you squatting properly on the platform of your foot. But what we want to avoid now is what's called a butt wink, where the bum winks underneath. And there's some pain that's going to be associated with doing that. Another problem that does come is when we arch our backs and over arch that back, especially when weight bearing, and there's some damage that can happen to that back. What we're looking for is a neutral zone for that stable core position, and Evan's going to share a little bit of information that he has on what's happening with the bony structure of the body and what kind of injuries can be avoided by just staying in that neutral zone.
Absolutely. So, again with a model, I'm going to give everybody a little bit of an idea of what happens at the spine when you do butt wink, or when you, as Curtis was talking about, or when you do flatten out your spine during a squat. Now if you go too low and don't quite have the core control, and you start to flatten your back out of that nice neutral position, a lot of the force starts to move forwards into the intervertebral discs, which are those supportive structures in between the bones at the front of the vertebrae. Now if we put too much pressure on these discs or compress them too much, just like a jelly donut, what basically happens is we push on it, the fluid on the inside of the disc can actually squeeze out, cause a disc herniation, or we can just injure the outside of the disc and get more of a discogenic type of pain. If we hyperextend too much, or if we cue ourselves to think neutral position instead of a neutral zone, what we often do is contract all the muscles along the backside of the body too much, compress the joints at the back of the spine, and get more of a joint or a facet joint irritation. Again, we want a neutral zone, not a neutral position. Don't cue yourself to think neutral position. Think nice and tight core all the way around, brace and breathe through the whole movement so that we have a little bit of play to go forwards and backwards, and we're nice and stable and powerful the entire time.
So now we're getting into a little bit more intensive injuries, stuff like a herniated disc or a ball's disc. So we obviously want to avoid that with avoiding that butt wink, but the injuries are associated by arching that back at the bottom of the squat. We're going to just find that nice stable trunk and back position that's going to allow you to stay in all the other cue that we've given throughout all this entire squat series.
Absolutely. We're going to get into the core a little bit in our next series, but remember, you want to be able to tighten up the entire core and use all the muscles as an orchestra. So don't think about just contracting one side of the body to pull yourself here or to hold yourself in more of a forward flex position. Think, create a solid trunk, so you're pushing through a trunk of a tree, not through the twig of the tree, which would be synonymous with the spine.
Solid trunk, allowing for more chest push through and not overarching or underarching of the lower back.
Absolutely.
Excellent.